Morning, everyone. Welcome back to our second webinar in this series entitled Glaucoma, the Silent Thief of Sight. We're so glad to have you join us once again. I'm Miss Lear Velarde, and it is my pleasure to be your host for today. As we celebrate the Sight Saving Month, we've got another power-packed session lined up for you, filled with fresh insights and practical takeaways you won't want to miss. So sit back and prepare your notes. We'll be kicking off in just a few minutes. Now, while still waiting for others to join, maybe kindly remind everyone of a few online meeting guidelines. Please keep your microphones on mute to avoid unnecessary noises. Turn on your cameras if your internet connection is stable. It will make us all feel more connected. You may use the chat box for greetings, comments, and later on to raise your questions. Lastly, stay engaged and active and be respectful as we go through the session of our program. Now, good morning, everyone. Please share this live stream. You can also drop your location in the chat and tag your family and friends. Exciting prizes are coming your way. Again, good day everyone, and welcome to our Sight Saving Month webinar focusing on glaucoma, the silent thief of sight. We're very glad to have you join us as we welcome together to learn more about protecting and preserving our vision. This event is part of our Olivarez General Hospital continuing commitment to promoting eye health in our community through education and preventive care. We have an exciting program prepared with valuable insights from our experts, so thank you for taking the time to be here with us today. And now, we are honored to begin today's Sight Saving Month webinar on glaucoma with a very special guest. Please join me in welcoming Dr. Melissa Orteza Sora, Chief Operations Officer of Olivarez General Hospital and one of our dedicated ophthalmologists at the OGH Eye Center, to deliver the opening remarks. Her leadership and expertise in eye health truly inspire our commitment to promoting vision in the community. Once again, Dr. Melissa Orteza Sora.
Hello. So good morning, everyone. Isang maulan but hopefully magandang morning sa lahat. Thank you for joining our OGH webinar series this morning. So today we'll be discussing the topic of glaucoma. So glaucoma is one of the most common eye conditions and actually one of the leading causes of blindness here in the Philippines. But fortunately for today, we have with us our very excellent glaucoma specialist, Dr. Kevin C., who will be teaching us everything we need to know about glaucoma. So after his lecture, we'll have a short Q&A session where you'll get the chance to ask your questions about glaucoma, blindness, or any eye conditions to Dr. Kevin. Of course, we'll also be sharing the services that we have at the OGH Eye Center, from diagnostic packages, screening packages, surgical packages, and everything you will need to take control of your eye health. And of course, last but not the least, at the end of this webinar, we'll be selecting 5 winners who will get a free consultation at the Eye Center. So to qualify, you will need to fill out the online attendance and feedback form so you could get the chance to win a free consultation. So again, thank you for joining us this morning. I hope na marami po tayong matutunan, and we hope to see you at the OGH Eye Center. Thank you.
Thank you, Dr. Melissa, for starting us off with such a good message po. Now, moving forward, to give us more deeper insight on this important topic, we are thrilled to welcome a highly distinguished guest speaker who will be sharing his expertise with us today, Dr. Kevin John C. Dr. Kevin obtained his medical degree at the University of the Philippines College of Medicine. He completed his residency training in ophthalmology and visual sciences and fellowship training in glaucoma at the Philippine General Hospital. Recently, Dr. Kevin presented his research on the clinical profile and outcomes of primary angle closure disease patients in a tertiary Philippine hospital in the 11th World Glaucoma Congress in Honolulu, Hawaii. Today, he will be sharing with us some important insights on glaucoma, the silent thief of sight. Ladies and gentlemen, please join me in giving a warm welcome to our speaker, Dr. Kevin John C.
Hi, good morning, everyone. Thank you, Dr. Mel. Thank you, Ma'am Lyra, for the nice introduction. So thank you for the Olivarez General Hospital for this opportunity for me to talk about glaucoma. I'll just share my screen. Okay. So good morning once again, everyone. I'm Dr. Kevin John C., an ophthalmologist and glaucoma specialist here in Olivarez General Hospital. Today, I will be talking about glaucoma, the silent thief of sight. So here's the outline of my short talk this morning. Glaucoma is a group of eye diseases that damages the optic nerve, leading to permanent vision loss and blindness if left untreated. Looking at the picture on the left, the optic nerve is the structure that relays what the eye see to the brain. Think of it as a wire or cable connecting a sensor to a central processing unit. The picture on the right shows what our eye looks like inside. The posterior or back portion of the eye is where the optic nerve begins. The left photo shows the close-up look of the front portion of the optic nerve, which is what we call as the optic nerve head. During an eye exam, a portion of the optic nerve is assessed, where it can be seen as a round structure called the optic disc, with a pinkish or reddish section representing the nervous tissue that takes the visual information to the brain. So ito po. The whitish central part, which is what we call the optic cup, represents absence of nervous tissue. Some amount of cupping is normal, but excessive cupping or an increase in the amount of cupping over time, like the picture on the right, suggests glaucoma. So here we can see that the cupping from this small cupping here on the left is now large. So it encompasses the entire optic nerve. So this is what happens in patients with glaucoma. Your ophthalmologist may tell you, lumalaki ang gitna ng iyong ugat o may paninipis na po ang inyong ugat sa may gilid. Glaucoma is the most common cause of irreversible blindness, meaning hindi na naibabalik ang paningin. It is estimated that around 111.9 million individuals will have glaucoma in 2040 worldwide. In some developing countries, 90% of glaucoma is undetected. In most cases, blindness can be prevented with appropriate control and treatment. Better awareness of this disease could prevent visual disability in many people. That is why we are doing this talk to promote awareness of the disease. So how does glaucoma occur? Before I show a video, so let us be familiar with some of the terms that I will be mentioning later. So first is aqueous humor, or the eye fluid. This is different from our tears, as aqueous humor is inside the eye. Second is iris, or our eye color. It is dark brown for us Filipinos, and light brown, blue, or green in Caucasians. Third is the trabecular meshwork, or the internal drainage system of the eye. Think of it as our eye's flood control project. And last is the intraocular pressure, or IOP, for short, which is the eye pressure. This is different from our blood pressure. So again, look at the photo on the right, our aqueous humor. it comes from the back of the iris, then passes through our pupil or yung gitna ng itim ng ating mata and exits through the trabecular meshwork at the angles of our eyes. So I hope we become familiar with the terms that I will be mentioning in the next video. So our eyes are connected to the brain through the optic nerve, a cable that relays what we see. The eye contains a fluid known as aqueous humor that provides nourishment to its internal structure. This fluid is produced behind the iris and then is drained out through a structure called the trabecular meshwork at the front part of the eye. In some eyes, abnormalities in the trabecular meshwork lead to impairment of the normal output, and IOP or intraocular pressure increases. This high IOP may damage the optic nerve head located in the back part of the eye and impair the communication between the eye and the part of the brain responsible for vision. So there will become cupping of the optic. Initially, it affects the peripheral vision, and if high pressure is left uncontrolled, it may affect central vision and ultimately blindness. The normal intraocular pressure ranges from 10 to 21 millimeters of mercury. Generally speaking, although high IOP may lead to glaucoma, it is not always the case, as the critical IOP level in which glaucoma damage occurs varies among individuals. Sometimes glaucoma may happen even in patients with normal IOP. This is what we call normal tension glaucoma, wherein there is the inability of the eye to handle mechanical stress or because of poor blood supply to the nerve fibers that leave the eye. On the other hand, sometimes there is no glaucoma yet, even in eyes with elevated IOP. This is what we call ocular hypertension. In these cases, your ophthalmologist will discuss with you your diagnosis and the next appropriate steps. Risk factors that make a person susceptible in developing glaucoma are high eye pressure, those who are 40 years old and above, those who have a family history of glaucoma, those who are Asian or African descent, so this includes Filipinos as Asians, persons who have a high refraction or grade in their glasses, like if you're very nearsighted or very farsighted, those who have diabetes and or systemic hypertension, and those who had previous eye surgery, eye trauma, or prolonged use of steroids. There are different types of glaucoma that you may hear from your ophthalmologist. First category is if your glaucoma is primary or secondary. Primary glaucoma occurs in susceptible or at-risk individuals. It does not occur because of any other eye problem. So, ibig sabihin, nangyari lang yung glaucoma ng kusa. This is more of genetic and how your eyes develop through the years. Meanwhile, secondary glaucoma may be caused by previous ocular trauma, associated systemic diseases like diabetes, use of medications, for example, steroid, topiramate, and some antidepressants, or consequence of complicated eye surgeries. Second category is if it is an open angle or angle closure glaucoma. As a review, the angle or angulo ng mata is part of the eye where the iris meets the cornea and the sclera. The drainage system of the eye is located at this region, which is the trabecular meshwork. If there is a problem in this area, it leads to elevated eye pressure, which makes the optic nerve at risk to have glaucoma. So open angle glaucoma occurs because of abnormalities within the spaces of the trabecular meshwork, leading to increased resistance to flow of the aqueous humor. So yung trabecular meshwork mismo ang may problema o nagmamalfunction. So isipin na lang natin para siyang kanal na mismong sa loob ng kanal may problema. Kaya yung agos ng tubig hindi maayos. Meanwhile, angle closure glaucoma occurs when part of the angle is obstructed by the iris. So this is the photo on the right. So as you can see here, the iris obstructs the trabecular meshwork or the angle of the eye. Usually, this happens in anatomically small eyes that makes the front portion of the eye crowded. So kung balikan po natin yung tungkol sa kanal, so yung opening ng kanal mismo ang may obstruction o may nagbabara. Kaya hindi makaagos yung tubig papunta mismo sa trabecular meshwork. Bringing these two categories together, your ophthalmologist may tell you that your diagnosis is a primary open angle or primary angle closure glaucoma or secondary open angle or secondary angle closure glaucoma. Although a bit technical, this is important because the diagnosis will direct your eye doctor the treatment options that are best for your case, which we will discuss in a while. Most glaucoma cases have no or very subtle symptoms. This is why it is called the silent thief of sight, as it may slowly take your vision away and you will only sense it once the disease is already in its advanced stage. However, a small percentage of people with glaucoma have episodes of blurring of vision, eye pain, eye redness, headache, nausea and vomiting, or glare. These are clues that you might have glaucoma. When you experience these, it is best to consult your ophthalmologist as soon as possible. What we have to understand in glaucoma is that it causes irreversible vision loss. Once the optic nerve is damaged, the damage is permanent. The vision loss is usually usually starts at the edges or the periphery of the visual field until a large area of vision is lost, what we call tunnel vision, if the glaucoma is left untreated. This is in contrast with, like, for example, a mature cataract, where the vision loss is diffused or sa lahat nakikita yung vision loss and curable after the surgery, yung cataract. So yun po yung kaiba. When you decide to seek consult with an ophthalmologist and your eye doctor is highly suspecting of glaucoma, he or she will perform the following clinical exams. First, second, gonioscopy to view the drainage angle and see if it is open or closed. And third, examination of the structure of the optic nerve with or without a disc photograph. In the first two examinations, although the instruments touch your eye, they do not hurt, as your ophthalmologist will place anesthetic eye drops on your eyes prior to the examination. Your eye doctor may also order some diagnostic tests, which may include an optical coherence CT ONH, or sometimes I call it a CT scan ng nerbyo ng iyong mata, to more accurately detect structural findings. Just a brief overview for this example. The right eye, so this is seen at the left portion of the test result. The right eye has inferior optic nerve thinning, depicted in yellow and red colors, which is highly suspicious of glaucoma. So this is available at the OGH Eye Center. Another diagnostic, which evaluates the function of the optic nerve. So here, a technician will guide and help you on how you will perform this test to assess what you can see in your visual field. In this example, the patient's left eye results show that she has what we call a superior altitudinal scotoma. So this is where the patient cannot see the upper portion visual. This is one of the visual defect patterns in glaucoma. So this also, the perimetry test is also available at the OGH Eye Center. Who should undergo glaucoma screening? In general, all individuals between 35 to 40 years old, all individuals with a positive family history of glaucoma. Interestingly, siblings of glaucoma patients have up to 10 times the risk of developing glaucoma. And patients with diabetes and systemic hypertension should undergo a routine eye exam. Your eye doctor will be specifically looking for signs of beginning glaucoma. If a patient is diagnosed to have glaucoma, he or she will be needing follow-up visits for their entire life. Unfortunately, sa glaucoma, may forever. The recommended interval between consultations may vary on a case-to-case basis. If your glaucoma is severe or if your eye pressure is uncontrolled, the follow-up will be closer and more frequent. If your glaucoma is under control without any signs of worsening, follow-up may be longer. For the treatment, first, the bad news. Unfortunately, there is no cure to glaucoma. But the good news is that it can be controlled, especially when discovered early, to prevent further visual damage. Glaucoma, think of it as it is quite similar to hypertension, high blood, and diabetes, kung saan wala talagang absolute cure, hindi talaga siya natatanggal sa ating katawan, pero pwede po ito mai-control. So, ganun po ang glaucoma. We treat because we aim to control the eye pressure and stop glaucoma progression. In glaucoma, eye pressure is the only risk factor that we can modify or change. Kasi yung ibang risk factor, halimbawa yung edad natin, hindi naman natin mababago. Yung pamilya, hindi natin mababago. At kung meron tayong high blood at diabetes, hindi naman natin ito matatanggal. So yung eye pressure talaga ang pinagtutuunan natin mainly ng pansin. So depending on the type and stage of glaucoma, treatment options include medications, usually eye drops and sometimes oral tablets. We can also offer, and kung hindi yan talaga kaya with medications and laser, operation or surgery. These are the procedures available at OGH. So we have the YAG laser iridotomy and surgeries and cataract surgery. These are usually done on an outpatient basis. Your ophthalmologist will explain what procedure is best for your case if warranted. So will glaucoma therapy improve my vision? In general, glaucoma medicines, laser, or surgery do be removed per se, but it can prevent you from further vision loss by controlling the disease. In summary, it is important to get regularly screened for glaucoma, especially if you have any of the mentioned risk factors. Once a patient is diagnosed with glaucoma, he or she will have to be under the care of an ophthalmologist for the rest of his or her life by detecting eye pressure elevations and glaucoma progression. Effective treatment options are available, and regular treatment and follow-up can help preserve vision, quality of life. So this is my main reference, which you can check it out as it is also patient-friendly. Thank you very much for listening. Good morning.
And there you have it. Thank you so much, Dr. Kevin, for that informative lecture, no, and for sharing with us some, types of glaucoma, yung mga risk factors, yung symptoms, and even types of examinations and treatment. I'm sure that everyone here talaga has gained new insights and learnings from your talk. All right, now it is your portion. No? This is a great opportunity to raise your thoughts, your clarifications, and even share your personal experiences that can enrich today's discussion. For those who would like to ask question, you may type it directly in the chat or comment box. Ayan, we have a comment here for other our one of participants, no? Dr. Kevin, ano-ano daw po ang paraan ng gamutan? Gamot, laser, or operation?
So for glaucoma, yung ating una, titingnan muna natin kung may glaucoma po ba kayo. Tapos kung mataas po ang inyong eye pressure. Usually, inuuna po natin ang pagbibigay ng gamot para bumaba ang ating eye pressure. Tapos depende po sa kung ito nga ay open angle glaucoma or angle closure glaucoma, pwede po tayo mag-offer sa inyo ng laser procedure una kung yung glaucoma nyo hindi pa ganun kalala para at least maayos po yung drainage ng ating mata. Pero kung sobrang lala na po talaga ng inyong glaucoma at hindi na kayang magamot at yung laser hindi na yun yung tatalab para sa inyong mata, operation na po ang ating i-offer. So case-to-case basis po ito. Usually, dun muna tayo sa pinaka hindi tinatawag natin invasive. So, kaya gamutan muna. So, pamatak usually po ito. Tapos, kung hindi na talaga kaya, dun tayo tumataas papunta sa operation po.
Thank you for that, Dr. Kevin. No? We have another question here from Miss Denise. So, hi, Dr. Kevin. If someone has a family history of glaucoma, how often should they get screened?
Okay. So, may family history of glaucoma. Dapat magpa-screen na po tayo agad para makita po natin kung meron ba talaga tayong mga risk factors or mga senyales na baka may glaucoma. So, during the consultation, meron po tayong gagawin mga tests. Tapos, kung kinakailangan, baka may laboratory test din tayo na kailangan gawin para mas ma-detect po talaga or makumpirma kung meron kayong glaucoma or wala. Kung wala naman po kayong glaucoma, maganda po ito. Pero depende din sa edad, yung follow-up after that screening, pwedeng after 1 to 2 years. So depende po sa risk factors na meron kayo at kung ano na makikita natin during the consultation.
Thank you for that, Dr. Kevin. No? We have another question from one of our participants, Miss Rio. So, Doc Kevin, can a general ophthalmologist manage glaucoma patient using health card since opta doctor consult is covered or need talaga to consult a glaucoma specialist? Thank you.
So para sa pag-diagnose po ng glaucoma, kayang-kaya po ito ng ating mga general ophthalmologist. So usually kapag komplikado na po ang glaucoma at baka kailangan nila ng tulong sa pag-diagnose dahil medyo minsan meron nga mga glaucoma na kahit mababa yung pressure, may glaucoma pa rin or mataas yung pressure pero walang glaucoma. So yung mga gantong klaseng kaso, doon nila usually i-refer sa aming mga glaucoma specialist. Pero kaya po ito ng general ophthalmologist po.
So, kaya naman pala ng mga opta. Okay, Doc, meron ako dito, hindi siya question, pero ano lang, parang shout out lang. So, from Miss Mimay, thank you, Doc. Very informative. I am one of your patients. See you soon.
See you
Ayan.
soon din po, ma'am.
We also have one question from Miss Claire. Paano daw, Doc, if may glaucoma and namumula ang eyes kahit hindi nag-eye drop?
Okay. So, kapag may glaucoma at namumula yung mata, so ibig sabihin nun baka mataas, so may glaucoma na po, tas namumula, baka tumataas po yung eye pressure. So, maganda po na mag-follow up po kayo sa inyong eye doctor para ma-assess po niya. Minsan din, namumula yung mata natin, yung para sa may glaucoma, tapos dahil may pinapatak na tayong gamot. So, may ibang gamot kasi na yung side effect po niya ay nakakapamula po ng mata. So minsan, yun po yung dahilan sa pamumula. So maganda po na matanong natin yung ating eye doctor kung ano ba talaga yung nagpapamula sa ating mata. Kung tumatas ba yung pressure, kung dahil po ba ito sa gamot, or kung may ibang sakit po sa mata, kaya namumula yung ating mata. So better ask your eye doctor.
Pero follow-up question lang dyan, Doc. Yung eye drop po ba nakakatulong sa pag-ano ng glaucoma?
Yes, lalo na kung mataas yung pressure ng mata, nakakatulong po yung eye drop. So, sa totoo lang, pang-maintenance talaga natin yung eye drop. So, dapat hindi po natin to ititigil kung pinasimula po ng ating doktor. Ititigil lang po natin ito kung nasabihan na po tayo na mukhang kontrolado na po ito. Baka dahil na laser kayo or may operation or kung mas controlled na po yung pressure. So, hindi po natin dapat, para siyang maintenance na gamot na po talaga. So, usually, pinapagpatuloy po ito unless pinapatigil na po sa atin.
Sige po. Thank you for that, Doc. We have another question here from Miss Denise. Doc, question po ulit. Does spending a lot of time on screen like phones or laptops raise the risk of glaucoma?
So, para po doon, hindi po. So, hindi ko naman sinasabi, hindi ko naman para kinukonsinte na lagi tayong dapat nasa screen at nasa cellphone kasi mapapagod din po yung mata natin. Pero, wala pong nakitang ebidensya na ang prolonged screen time ay nakakapag-cause ng glaucoma.
Okay po. We have another question here, Doc, no? So, gaano daw po kadalas akong magpa-check up kung may risk ako ng or may glaucoma na ako?
Okay. So, natanong na din po ito nung kanina, pero ulitin ko na lang po na yung depende po yon sa makikitang risk factors ng inyong eye doctor during the first consult. So, usually kung hindi naman masyadong mataas yung inyong risk at parang normal naman yung pressure po, usually can range from after 1 to 2 years. So, medyo matagal po yung magiging follow-up kung gano'n.
So, medyo matagal na. Another question, Doc, from Miss Landhurst, no? Speaking of eye drop, can we use eye drops daily na over-the-counter like yung mga eye mo, no? Or need ba na nireseta talaga nung opta yung eye drops pag may glaucoma?
Okay. So, yung mga tinatawag natin IMO or mga lubricant, so pampadulas po ito ng mata para lang for comfort and usually for dry eye. So, wala po silang connection actually sa glaucoma. So, kung binibigay lang natin yung mga glaucoma eye drops, usually mga pampababa ng pressure kung mataas po talaga ating pressure. So, ito po ay kailangan ng prescription kung sakali.
Thank you for that, Doc. We have another question here from Miss Caroline Manglino. Doc, good morning po. Ask ko lang po, my mother had a cataract extraction that led to retinal detachment, but the retinal detachment was successfully surgically repaired. Is it possible for her to develop glaucoma?
So, usually, kung naoperahan po for retinal detachment, hindi naman agad-agad po nagkakaroon ng glaucoma if ever. Pero it's a possibility po. Kaya po after maoperahan, usually ng ating mga kaibigang retina specialist, hindi lang retina yung titingnan po nila, pero pati na rin yung pressure ng mata. Kasi minsan dahil sa retina surgery, tumataas yung pressure. So, yun po yung pwedeng mag-lead po to glaucoma. So, if ever man tumaas yung pressure, iko-control naman po nila yun. Yun yung unang usually na nangyayari. Tapos, kung sakali na tumataas talaga, na hindi na kaya ng gamot, doon usually nila nire-refer sa aming glaucoma specialist. So, hindi naman siya pag nag-retina surgery ka, 100% magkaka-glaucoma kaagad-agad po. So, depende po ito kung magkakaroon. So, maganda po na mag-follow up po.
Thank you for that, Doc. No? One question pa po is, kapag may glaucoma na, nagagamot po ba ito or nakokontrol lang po?
Okay. So, ang glaucoma po ay nagagamot pero control lang po ang nagagawa ng ating gamot. Unfortunately, wala pa tayong nahahanap na paraan para matanggal talaga ng 100% yung glaucoma sa ating mga mata. So, yun nga, ang sabi ko po kanina na wala pang cure sa ngayon. Ibig sabihin yung cure yung natatanggal yung glaucoma. Pero ito po ay nakokontrol para hindi po lumala.
Okay, thank you for that, Doc, no? Last question po from Miss Joanna Vanessa Olano. Doc, can glasses or contact lenses help with glaucoma?
Okay. So, kapag may yung glasses at contact lenses, usually para po yan kapag may error of refraction or may grado yung mata. Yung glaucoma po kasi, usually, ang ina-affect niya is yung gilid or yung periphery muna. So, unfortunately, itong naapektuhan na ng glaucoma, hindi kasi ito yung sosolusyonan ng glasses. So yun yung hindi maganda sa glaucoma, hindi siya yung nako-correct. So ang mako-correct lang niya ay yung mismong may grado ka sa mata. Pero yung glaucoma itself, hindi kung naapektuhan na nga ng glaucoma yung paningin, hindi siya yung nako-correct ng salamin po or contact lens. Sorry ma, I think you
Sorry, kami po pala. We have another question, Doc, from Miss Ted Santos. No? 86-year-old mother, hindi na po makorek ng eyeglasses as per OptoConsult. Sabog na daw po sa loob. Ano po meaning nun?
So, depende po yun kasi sa loob po ng ating mata, marami pong struktura. So, meron din pong retina, yun yung pelikula ng ating mata, tapos yun nga, yung optic nerve or nerbio or ugat na ating mata. So, maganda po na mapakonsult po kayo at ma-clarify po dun sa doctor kung alin bahagi po yung ibig niyang sabihin na sabog. So, for that question, ang mahirap po sagutin kasi depende po sa findings.
Thank you, Doc. Salamat daw po. No? So, thank you so much, everyone, for your active participation and most especially to our speaker for addressing each question with clarity and compassion. Now, if you would like to schedule a consultation with Dr. Kevin about glaucoma or any other eye concerns, please refer to the clinic details displayed on the screen. Also, we are proud to announce that OGH Eye Center also offers a wide range of diagnostic tests and services to cater to your eye needs. Under subspecialties, we have cataract, glaucoma, pediatric ophthalmology and strabismus, retina for medical and surgical, and lastly, uveitis. We will also be flashing our list of clinical and surgical services. We're also excited to announce that the OGH Eye Center now offers glaucoma screening package designed for early detection and prevention. This all-inclusive package includes the doctor's consultation fee and advanced diagnostic tests to help you protect your vision. In addition, we also offer a glaucoma diagnostic package designed for those who would like to avail of diagnostic procedures only. We also want to share that the Olivarez General Hospital Eye Center also offers all-inclusive cataract package starting as low as 20,000 pesos per eye. Well, on top of these, we also offer all-inclusive pterygium package starting as low as 10,000 pesos per eye. If you have any questions regarding these packages, please feel free to contact the Eye Center via our official Facebook page or via mobile. Now, before we close today's webinar, we kindly ask everyone to take a few moments to answer our feedback form. Please scan the QR code on the screen to access the form. Your comments and suggestions are valuable in helping us improve future sessions. And of course, as a special thank you, answering the feedback form will give you a chance to win a free consultation with one of our ophthalmologists at the OGH Eye Center. Don't miss this opportunity. Furthermore, please note that only participants who answered our feedback form can get the chance to win free consultations. We will be announcing 5 lucky winners later today on our official Facebook page. Thank you so much for those who are still commenting po, no? So we have another comment here from Miss Seth Santos, no? Highly recommended daw po ang OGH Eye Center. Nakasked po ang father ko for September 17 for cataract operation. Thank you, Miss Seth, for always supporting OGH Eye Center. Well, moving forward, as we come to the conclusion of our program, today was not just about information. It was about empowerment. You now have the knowledge to protect your vision and help others to protect theirs. Just like what Dr. Kevin said, glaucoma is called the silent thief of sight because it often progresses without symptoms. But here's the good news. With early detection and treatment, vision loss can be prevented. Thank you so much, everyone, for being part of this important conversation today. Together, we can fight blindness, one eye exam at a time. And now, as we officially close this online celebration of Sight Saving Month, we want to take a moment to extend our heartfelt gratitude to our distinguished guest speaker, Dr. Kevin, and of course to each one of you for being part of this event. On behalf of Olivarez General Hospital, this has been your host, Miss Lira, and thank you for joining us. For more help, tips, and talks, please don't forget to like, share, and follow our Facebook, Instagram, and TikTok accounts. Until next time, stay safe, stay informed, and most importantly, take care of your eyes. Let us all move onward to great health.